This video shows endoscopic third ventriculostomy with biopsy for a 1-year-old child. This child presented with large head and was found to have large tumor in the posterior fossa projecting inside the aqueduct causing gross hydrocephalus. The burr hole was placed 1 to 2 cm anterior to the usual coronal suture so that trajectory to the tumor as well as the floor of the third ventricle can be made. The prebasilar space was narrow and ventriculostomy could not be done. Hence, the floor of the third ventricle was rubbed against the dorsum sella gradually to make it thin and then finally perforate, including the liqueous membrane. The perforation was widened using Fogarty catheter and balloon. The balloon was deflated and the catheter withdrawn, and the bare pons could be seen through the stoma. Then the endoscope was steered posteriorly towards the aqueduct, and the tumor pulse through the aqueduct could be seen. The scope was taken deeper, and with a biopsy forceps, the biopsy was taken. The biopsy forceps was dipped inside the tumor, and the jaws opened, and biopsy was taken. There was very little bleeding which could be controlled with irrigation. At the time of withdrawal of the scope, bleeding from the foramen of Monro could be seen, which was controlled using bipolar and irrigation. Hemostasis was achieved and the scope was withdrawn.